Some of the achievements that we've had for the last year ever since AMPATH came into play, one was the integration of services. We moved from a standalone DICE at Tupado to a hybrid MOH setup at Kakuma Health Center. Two, we were able to identify and enroll first 90 MSMs in the host community, where it is always has been a perception that there are non-MSMs in the host community. We were able also to surpass our FSW targets every time we are given the targets, and we have 100% recruitment and retention of our FSWs into the program. We also adapted a safe space at the hospital premise. This is important because the female sex workers and the MSMs come in and they get to do peer education, and they are offered key messages on health. And we were also able to offer integrated comprehensive services at the outreaches that will include PrEP, and also ART services. This helped us a lot in adherence counseling and also defaulter tracing. Some of the challenges we have experienced during the whole year include we had low viral load uptake among the offsite clients, but this has improved because one of the mitigations that we used was line listing the clients for viral load and making sure that we do an individual follow-up for them. Then we make sure that we linked with the offsite facilities to get our viral load offsite facility clinicians, just to make sure that our patients are accessing viral load. Also, we realized that we had low reporting on GBV part of last year. So we really conducted a GBV training, and GBV, we wanted also to set up a GBV crisis response team, of which we know that we are on the way. We are preparing to set up the team so that our FSWs and MSMs can be helped in matters GBV. Then COVID-19 was a big factor because COVID-19 came with closure of hotspots. Then social distancing was also a problem for the key population. We had the government time curfews and the government directive on also issues of transport. So for us as a DICE, we were able to use technology. For example, SMS, just to alert our FSWs and MSMs on the days that they were scheduled to come in for a test. We also used appointment setting so that we can reduce overcrowding at the DICE, and we staggered their appointments throughout the whole day to avoid overcrowding. Health education, we majored on health educations because we wanted our peer educators and our outreach workers to offer the information and to prevent the risks for us during that COVID period. We also scaled up the use of self-testing kits where possible, whereby we allowed the peer educators to pick kits and distribute to their peers, and in turn avail the results for us at the DICE so that we can actually see who was tested positive. We link them into care and treatment. Then for the FSWs and MSMs who are positive in our program, we considered a 3-month, multi-month dispensing for them, regardless of the age and also the status of the viral load. And then we refilled PrEP for 3 months for most of our clients. And then we had the DICE operating on flexi hours that really allowed our key population to come and seek services at any time that they need the service. Other things, we were able to offer peer educators a refresher training course, and we were also able to do a PrEP training for the peer educators who are not trained on PrEP. This in turn saw our numbers of PrEP actually increasing. And one thing we did as a county, we were able to also form a community advisory board whereby the peer educators and the beneficiaries could actually come in and tell us their problems, and we look at a way forward for them. Okay. So for us as Kakuma Health Center, we have integrated our services, meaning that even the nurses and the staffs at the hospital can actually interact with the FSWs and the MSMs. So I would say it is a symbiotic relationship, because now you see that the FSWs are comfortable in going to the family planning, finding a nurse in that family planning room, and actually getting service from that nurse. They are able to go to the lab, find the laboratories at the lab. They are able and comfortable to seek service at the lab. They are able to associate with all the staffs in the facility without being discriminated, without being stigmatized, because they are FSWs or they are MSMs. A plus thing, the MSMs feel comfortable actually to come and ask for help from any staffs in the facility. We would really love for the program to continue supporting us in strengthening outreaches, because it is through the community outreaches that we are able to prioritize with the peer educators and also the outreach workers, so that we can reach out to the female sex workers and MSMs. And I would like to report that for us, we have also realized that MSMs actually don't go to the hotspots. MSMs, they do a home-based approach. So we would really love for the program that is, we would really love for the program to actually strengthen the outreach component for us.